Hi, I'm Dr. Johnny. Thanks for joining me today. We're covering glycolics and glycolic acids. I did a recent video on your basic skincare. What are the basics that you need to not break the bank but get great results, and what ingredients are you looking for? Everyone wanted me to cover a little more in depth. Now, it's key to understand here, if we're going to do and talk about this, you want to have your skincare routine and an understanding of your own skin somewhat down for you. Have the basics down, have it stable, and it's going to take a degree of education. Everyone's skin is a little different, and understanding your skin, how it reacts to different products, and what are the ones you're going to gravitate to because you're getting good results takes time and effort. I always recommend having a provider or skincare specialist guide you along, because once in a while you're going to try and step it up because you believe you need a little more exfoliation, you need a little more peel, a little tightening, and you're going to run into a little bit of trouble potentially. I'll give you a prime example super quick. I did a peel about 6 months ago, and I was pretty aggressive under the eyes and in the chin area, and it really took me 6 weeks to heal from that. I had a little hyperpigmentation. I knew I was going to be happy with it in the end. However, if I didn't know and have faith and have other products to help heal it, and I had to change how I was moisturizing and how I was dealing with the hyperpigmentation, and I happen to have products, of course, in my office to help with that. I would have been pretty scared if I was a home gamer. What's a home gamer? With all this stuff, is someone who wants to do it at home. Of course, people are going to want to do it at home. It's going to save you money. It's going to save you time. Some things are safe to do at home, and others are less safe. So with that being said, we're going to dive into glycolics. Your skin should be stable, meaning you should be on a regular skincare routine with your basics that I covered in that other video, and you should be tolerating it well without a lot of inflammation. Inflammation ages one. So there's good inflammation and bad inflammation. A lot of people, one of the biggest mistakes when going to a glycolic or other acids, salicylics, other peels, they believe if their skin is tight, if they have that windburn feel, sure, it's tight, it looks good, it might be a little red, they can use cover-up. Prolonged periods of time, greater than a week or two, that's going to create an aging look long term. So understand, when you go down this road, it's going to take some education. Do it with your provider if possible, but let's dive straight into glycolics in 3 seconds. Okay, so glycolic acids are part of the group of alpha hydroxy acids. What does that mean? Well, they're part of, think about fruit acids. Another one that you might know would be lactic acid. Glycolic acid is a smaller molecule, which means it penetrates more deeply. The lactic acid would be, you'll find it in all kinds of things, even sunscreens, you'll find it in creams and washes, but the glycolic acid in general is going to be more intense as a peel especially. It's something that needs to be neutralized, so that's important. A lot of peels, when people are getting them, they get frosting, and you can watch my video on the VI peel. I remember doing that one. It's up here on the YouTube channel. I'll put a link in the description, and that patient had frosting, and you can see it. I think we discussed it in that video. That means there's protein changes occurring in the skin, and a lot of people might not want to go beyond that level. A professional, certainly I see frosting, depending on where it is, I'll let it go. Beneath the eyes, you could let it go, but for me, the downtime for the patient, you're going to have to handhold them through that inflammation and give them the appropriate skincare, and sometimes even a small steroid for that to improve over time. So just be mindful. Again, these are things you're going to see. These, as I said before, are really professional grade levels that I'm talking. And while we're here, let's talk about percentages, because this is a TCA. Maybe we'll do a video on that if you like these, but here's a glycolic 30%, okay? So glycolics, well, you'll see 8 to 10% in skincare and different things over the counter. When you start to get to 20%, 30, 50, and then right up to 70%, one thing to note, just because you have one company and you got a 30% glycolic, doesn't mean it's going to be the same bioavailability of another one. And you can get complex in this, Hasselbalch's equation, everything. You're looking at pHs, because something with a lower pH, a more acidic pH, and that's why we pre-treat the skin with acids or acetone. People are often scared of acetone. You're putting that on the skin? Yeah. A lot of times that's your pre-skin cleanser or prep because you're trying to get the skin as acidic as possible. As well, the lower percentage of glycolics, like say 10 to 20, maybe even to 30%, will prep the skin for something more, okay? So understand there's a big art to this, but in general, yes, lower percentages you're going to find in skincare. Everyone's going to have a slightly different goal, okay? And so let's say you had someone with a lot of wrinkles and fine lines. You're trying to get them up to a higher percentage of glycolics. 20 years ago, how I used glycolic peels is my goal was to get everyone up to 70%. And some people left the clinic and it was a little scary. You look, well, my gosh. Are they going to heal okay? You know, because we did not have erbium YAG type lasers that we have today. That being said, we relied more on peels, and that's why a lot of old schoolers are very peel oriented, and we still love peels because we saw what they could do. The phenol peel would be a very aggressive peel that we put people under for. Not used very often, but making a comeback. But glycolic, 70%. That's an intense peel. So you can see you'll use a 10% glycolic very differently than a 70%. And if you're moving up more towards wrinkles, fine lines, skin rejuvenation, then you're trying to get your percentage up. And that's what your clinic, your physician, nurse practitioner, PA is going to likely try and do if they're using glycolics. One note here, you're going to notice a lot of peels that are recommended by your provider nowadays are going to be combinations of lower level acids. And that's because what we found was instead of hammering the skin with a 70%, why not use lower levels of combinations? Ring a bell? Yeah, we do the same with our fillers. Combination of fillers, PDO threads, neuromodulators. Okay, so there you go with the concentrations. Like I said, this is a 30%. That's more of an exfoliating dose so that the skin cells that are stuck down, you're helping to turn them over without the level of inflammation that I talked about. Now, when people, again, sticking with the same line, because a 30% is not the same as a 30% maybe in a cream or from a different company. So amongst the same line, people then try and get to a 50%. This is where you have to be very careful, as I aforementioned, but this is where you're going to peel more. And when you get to more to 50 to 70%, you're going from exfoliating to pigment. You're now going to start to get around 30 to 50%. You're going to start to get pigment, solar keratosis, sun damage, and rhytids. Okay, so irregularities in the skin, fine lines, and wrinkles. And this morning, I should bring up, I had maybe 7 questions on YouTube, and I don't know why these things come in bunches, you never know, but it's what spurs me on to do the videos. And it was were patients in their 60s, and they said, you know, all your videos are young people. Now, a lot of mine have 50-year-olds. Sure, they look 40, but there's a lot of 50-year-olds in my videos. But they're asking, these are patients in their 60s going, hey, did I miss it? Am I too late? One question was from Germany, and there's a picture if it was the person. It was white skin type 2 to 3. By 60 to 70, skin type 3, a lot of times, depending on what they want, okay? Because in their mind, they might be thinking they want a tight face. That is going to be not chemical peels, not minimally invasive procedures. If they want everything perfect, they're going to need surgery, followed by everything that I do. Okay, all minimally invasive. You still need fillers, collagen stimulators, and everything else. On the other hand, if the patient just wanted a little more glow, they want a little bit of tightening, they were willing to add some fillers, threads, biostimulators, that's a great candidate and they're going to be happy. So without seeing a person, you can't tell is it appropriate for them and then what their expectations are, because everyone watching this video, all of you, are saying, oh, okay, I'm going to go do a glycolic peel. I'm going to get a treatment done that I talk about. And in your mind, your expectation is very different amongst, well, there's 30,000 people, 40,000 watch these videos. There's 40,000 different answers. So you see, depending what level you want to get with the glycolic, you can target different things. So when I say we're targeting fine lines and wrinkles, that's fine lines and wrinkles, not a jowl hanging down. Because people are going to think, oh, if it gets rid of fine lines and wrinkles, it's going to lift my jowl. No, that's structural. Well, are there natural ways you can get alpha hydroxy acids? Remember, I said there's alpha hydroxy acids, and there are also beta hydroxy acids, which is a salicylic I talked about, but the alpha are derived from fruit. So sugar cane, for instance, is glycolic. But the lactic acid that we talked about, and then what about some natural ways? A lot of people are probably asking, well, what about acids for my face that I can get from the grocery store maybe, because you can get fruits there. And you're absolutely right. Citric acid, papaya, grapes, citric lemon would be a common source. And people make up products and masks and different things you can put on your face to get a natural, low-level exfoliation. There's many topics on this. You can Google search it. If you want to cover one here, we can always have fun and do one. But of course, most people that are coming into a clinic like mine want dramatic. They don't want to be, well, maybe they see it, maybe they don't. If someone gets Botox and they got one muscle fiber moving, they come back in and go, hey, it didn't work. So for me to put a fruit acid on the face isn't fruitful, so to speak, because they're not going to see it. They want aggressive. So in a clinic like mine, you're thinking more like 50 to 70% glycolics. But as I said, most people are going to be combining low-level salicylics, glycolics, and other types of peels to get those proprietary combination peels, much like the VI peel that I also have a video on. So that's glycolics, and we're going to do other videos on other acids, facial acids, exfoliants. We'll do one on retinol. I know a lot of people are on that. Certainly watch the video on pores. That covers salicylic washes. Very important because salicylics are lipophilic, and they do very different things than our glycolics, which are mainly meant for brown spots. Yes, it exfoliates, and it will help with pores, but something that's more lipophilic that will be attracted, in other words, to oils, will help with different things. So join me on that video. Also, hyaluronic acid, my video on that. Hyaluronic acid is a great antioxidant and ingredient. Follow those videos. There's a list of videos in the description on skincare I'll place. And be safe. Use your physician as a guide. Join me here for much more on fillers, neuromodulators, PDO threads, and skincare to keep your skin and body beautiful, healthy, and vibrant.